It is with immense pleasure that I welcome you to this conversation as part of the American College of Surgeons Bulletin Brief from the Frontline Surgeons Voices. And with me today is our leading surgeon's voice, our president, Dr. J. Wayne Meredith. Welcome, Dr. Meredith.
Thank you so much. I'm glad to be here.
I am absolutely delighted to see you today, looking in fine feather, ready to chat with us about the college and about some of your own personal experiences during your year as president. So I'd like to start out, if I might, just stating that you took over the reins with the expectation, I imagine, that COVID was going to be on the downslope and that by Clinical Congress 2021, we'd all be together again and had a adapt, as it were, and be resilient on the way. So perhaps first you could tell us a little bit about how the college adapted during your presidential year.
Well, it has been quite a year for all of us. We're going to later talk about some of my personal sort of health issues over the year, and I've gotten through this time with a mantra of endure, adapt, survive, and thrive. And as I think about it, that's exactly what the College of Surgeons has done for the last year: endure, adapt, survive, and thrive. We've endured and as surgeons, we have all done the exact same thing. We've endured the pandemic. And that's been some heavy lifting to endure. We still have practices where you can't post non-time sensitive cases, and we still have shutdowns and supply shortages, and there's nursing shortages everywhere across this country, and surgeons across the country are just enduring that. And at the level of the College of Surgeons, we've had both to endure and adapt to lack of travel, and we've really become Zoom central. The American College of Surgeons has figured out how to have meetings, and there are new regents, a couple of them I'd never met before. They're regents from all the different specialties. And there are new regents who are very good friends of mine today that I've never shook their hand, seen them in person at all. We just had so many Zoom calls, so many opportunities to work together, sometimes on really hard issues, that even though it's all on Zoom, you can learn a person's character, and you can learn their point of view of the world and their integrity. And it's really amazing that we've had to endure that and adapt in that way. We have definitely survived. We are financially sound. Our programs are booming. We've adapted to having site visits by Zoom and conferences by Zoom. We really know how to put on a good Zoom conference now. Y'all need to sign up to go to the Clinical Congress this year. It's going to be terrific. So we've endured, adapt, survive, and we are in fact thriving. There are a lot of things going on. This year, we have focused on, under the leadership of Scott Levin, the better specialty engagement, and under your leadership, Steve, improving our communications program. And I started a racism task force, but Tim Eberlein has taken over the leadership of that at a regimental committee level. And we have really worked hard for the course of this last year to improve all three of those areas. And I think we have been magnificently successful at doing those three things, all the while doing all the things the American College of Surgeons does: fighting off Medicare pay cuts, helping surgeons with guidelines for how to ramp down practices and how to ramp up practices due to the pandemic, figuring out how to put on a clinical congress again. It's been an amazing year to put all of those things together.
Thanks. Indeed, it has been an amazing year. And I think in addition to being an amazing year for us collectively as the American College of Surgeons, it's been an amazing year for you personally. And I think it's an understatement to say health issues, because you certainly do thrive. And I would like to know if you're comfortable sharing some of your personal journey since you took over as president.
Sure. I started as president in October in the height of the pandemic. and we changed a lot of things that we ordinarily would do. So, typically the president goes all over the country and to some extent all over the world representing the college. I have Zoomed all over the country and Zoomed all over the world representing the college, especially in the first maybe 4 to 6 months of it. In February, I was diagnosed with acute myelogenous leukemia, AML, which is not a great prognosis thing. When we first looked it up, it said I had a 2% chance of living 3 years. I didn't look it up, Google it, because I had a doctor's appointment with an oncologist the next day, and I thought it better off to hear from him. But my wife did Google it. So I came home that day to a very tearful household. The next day, we learned that with my particular type, with the things that can be done, nowadays, I probably had a 20% mortality rate, a 20% survival rate if all went well to get through it. That's a pretty tough pill to take. But at a 20% rate, that meant pull out all the stops. That's a big enough chance of, they won't use the word cure in the cancer world, but permanent remission is the word we were striving for, right? So I'm still striving for a cure of this thing. But anyhow, so I went through 4 rounds of chemotherapy in preparation for a bone marrow transplant, and then had the bone marrow transplant and began recovering from that. And I'm still recovering from that. I'm weak as a kitten, but I'm actually a lot stronger than I was. I'm as weak as a 6-week-old kitten now, instead of a newborn kitten. But it's been a real experience, a real educational opportunity to be so deeply embroiled in the healthcare system. Our cancer center is fantastic, and our leukemia group is one of the top in the country. So I luckily was in very good hands right nearby. And that was terrific. My brother has not had cancer, but he's had a lot of heart disease. He's had 29 heart caths. So he has been in the hospital some, mostly 3-4 day stints. I've had several 40-day stints in the hospital. But he called me to say, I have some advice I need to give you, and you just need to listen to this. And it's medical advice. I said, well, I'm a doctor and you're a computer industry guy. And he said, have you had 29 heart caths? And I said, okay, what you got? So, and his advice was, the hardest thing about being a patient is no control. And I think we all need to learn from that, right? To learn from that sense of no control. And trust me, it was the hardest thing about it all, no control. And he said, but you do have control over one thing, and that's your attitude. So I began working on proper attitude. And he said, and the proper attitude is to develop an attitude of purposeful, intentional compliance. Purposeful, intentional compliance. And so I began from the very beginning of every one of these situations where you want to take control of the situation. I have just been willfully compliant, and my control over the situation has been my ability to control how willfully compliant I was. And it has made a huge difference throughout my hospital stay. I mean, I think had he not said that, I might have been the worst patient they'd ever had in Baptist Hospital. I might have been, but I was probably one of the best they've ever had in Baptist Hospital because I did that. Now, many of you heard my presidential address, and a couple of things that I said during that, I've lived my life by, and during hard times, when things get tough, people revert more to their true self than ever. They become a more pure version of themselves. When times are tough, it's much harder to pretend to be a better version of yourself than you are. And so during this time, in part, I reverted to presumption of virtuous intent. I believed everybody had virtuous intent when they came in my room, no matter how dumb they seemed to be at the time. They had virtuous intent, right? Every one of them was coming in there to help me. even if it was to check my blood sugar, despite the fact that I was wearing the Dexcom transmitter on my arm and I could check my own blood sugar every 30 seconds if I wanted to. Willful compliance. I willfully complied with that. And most of them learned not to have to, they didn't have to do it. And we're happy to not have to go to the trouble. But every now and then one would say, it's my duty, it's my job, it's on my list. And I would say, here's my finger, stick away, right? That would not, if my brother hadn't told me about that, that was not how that would have come out at all. There would have been tears, right? And so presumption versus intent. The other thing is catching people doing something right 6 times as often as you catch people doing something wrong. And I made a point of telling people, if I had a new nurse, one of the things I would tell her is, you're lucky to work here. This place is fantastic. And I would brag on their safety protocols. And that, which had the effect that she would pay a lot of attention to the safety protocols on me. Right. She might only be paying 50% attention to the safety protocols in the next room. I doubt it, but she could have been. But in my room, she paid total attention to it because I already bragged on her ability to do that. Right. And so some of those things I did more heavily than because they're my nature. Right. They're my nature to pull teams together and to brag on people. And so I learned that. I learned there are times when all you can do is endure. I got neutropenic colitis and then probably neutropenic gastritis and a terrible hematemesis, which is probably the worst experience of it all. Believe it or not, it's a medical audience. Imagine if you had to take a can of cranberry jelly and just gulp it all down in one gulp. Now imagine if you do that in reverse. That's what massive hematemesis is. And it was gross and scary and horrible. And I still have dreams about it. I mean, it was big. And I had multiple bouts of sepsis from this colon every day. And I'd have a shake and chill, and then I would get weak. And I could just feel the protein being sucked out of my muscles. And interestingly, I had worked my tail off with a personal trainer, lost about 40 pounds, put on about 10 or 15, maybe 20 pounds of muscle. I'd gone from deadlifting a broomstick to deadlifting about 130 pounds. No, deadlifting almost 200 pounds. Then I got sick and I could just feel those muscles drifting away. Now I can't deadlift a broomstick again. All of that has been from sepsis, the metabolism that occurs. And, I think there's a real lesson for even like a minimally invasive surgeon. If your patient gets an infection, they are going to have these cytokines flying through their body, and it's going to change the way they heal our anastomoses, and it's going to change the way they heal overall. And it's going to turn that. I think back to doing heart surgery. Every now and then you just have that patient, their leg wound did poorly, and all of a sudden they weren't getting out of bed, they weren't going anywhere, and it just seemed like a willpower problem. It's not a willpower problem. I still had all the willpower I ever had, but I could not will myself to get out of bed more and walk the halls like I had been doing and all that stuff. That is something for every surgeon to be watching for. If your patient has some kind of infection, their recovery is going to be slowed to a small or large extent. And think back on that pneumonia that they had 3 days ago, or that line sepsis that they had last week, or that wound infection that you had to open up, or that perc drain you had to put in the right upper quadrant. That's why they're not recovering the way they were. And there's hardly anything you can do about it other than give them lots of protein and lots of encouragement, right? And make them work harder at it and understand what it is. I learned a lot about being a patient, and I learned I don't want to do it any more than I have to anymore.
Well, thank you for sharing those incredibly personal details. Very, very powerful. And I suspect,
Steve, I didn't say, but I should have said, I think one of the things for us to learn from this is to help our patients get to that place of willful compliance. So, I think if you're fixing a hernia, it's not that big a deal. But if you're doing an esophagectomy on somebody, or total abdominal colectomy, or maybe even a hernia, the extent to which we can explain to our patients the difference between willful compliance, how well the nurses can treat you, how well you will do in terms of subjecting yourself to your therapies. If we can help them understand that adopting an attitude of willful compliance toward it all, I believe is one of the greatest gifts we can give our patients. And I'm developing a little, 3-minute mental tutorial that I'm going to give all of my patients in the future. I have one that I used to give paraplegic patients on how to recover and that kind of thing, or an amputee. But I'm going to start doing a version of that is surrounding willful compliance as a patient for all the big operations I do, assuming I get back to doing big operations. And you can bet your ass I'm going to.
I have no doubt. I wouldn't want to bet with you on that topic. I'm fortunate enough to be able to speak with you many, many times during the last year, and I've seen what I think may have been the nadir, and now looking at you today, I have no doubt you'll be back doing big operations, probably sooner than anyone would predict.
Yeah.
But in addition to your 3-minute prep talk for your patients, it's something all of us would benefit. I don't know that everyone will be able to adopt the same exact convincing attitude, because the empathy is required, having been the patient, but nonetheless, having that germinal seed and hearing those words of wisdom is going to be wonderfully powerful. And that 3 minutes will undoubtedly be the most important 3 minutes of the entire pre-op period, judging by the way you've done with the words of wisdom from your brother.
Yeah, that's exactly right.
Which is great, which just goes to show maybe it's better to listen to a computer guy than a surgical guy when it comes to things like that and life skills. It's really great to see you today. Again, I'm delighted that you're in the shape you are, but I would like to give you, of course, the last words in closing in our chat today for our viewers.
Well, I just want, if this goes out before the Clinical Congress, I would like to tell everybody, please sign up for it. It's going to be even better than last year. And last year was a blockbuster. But we have lots of broad education that any surgical specialty should be able to appreciate and enjoy, special outreach to specialty societies, but also lots of DEI, lots of communication work. You can go learn how to Twitter and how to do those things and how to set that up in your office. And see some of the things that we're doing. There's lots of things that'll be valuable to across the board of surgery. There's also lots of just blood and gut surgery. What do you do for a bleeding to a deal ulcer? What do you do? How do you manage diabetic gangrene? There's just a lot of that. Postgraduate courses are back this year by Zoom. It's possible to sign up for some of our postgraduate courses, but there is more than you can eat smorgasbord of free CME, and you can go back and get that CME probably till after the first of the year. Last year we did it well into January. Into January, it was still available to go back and look at it and sign up for it. It makes it much more accessible to our international fellows and international surgeons that want to be fellows. And it makes it much more available to residents and whole groups. We can't take our entire trauma group to the Clinical Congress at one time, right? That leaves nobody home to man the shop, but everybody can get to the Clinical Congress through this method this year. And there's a lot of good reasons to sign up for it. It's the best surgical educational offering, I think, available today. So please sign up for that. Think about San Diego next year. Hopefully we'll be in person. I think many of us are craving the opportunity to actually sit down with someone, maybe have a drink with them, maybe go for a run with them, right? You can't, they're just some things you can't do by Zoom. And but this year is going to be a great Clinical Congress. Please sign up for it, please attend, and please get as much out of it as you possibly can. It's our job to serve the surgical public. So anyway, thanks for the opportunity to say that.
You've served us incredibly well under the most challenging circumstances that anyone should imagine. And we owe you an amazing, incredible debt of gratitude we could never repay for what you did during your own personal battle. But we know you've won the battle and you've won the war, or almost won the war, but you will win the As you said, cure is in your cards and big operations are in your future. We're all rooting for you. We all wish you the absolute best of sustained health and look forward to shaking your hand and going out for a walk.
Absolutely. Can't wait to do it. Can't wait to do it. Thanks.
Great. Stay well.
Appreciate it.